We always do a combination of hair transplantation and hair loss treatment. In what case should you choose hair transplant? For both male pattern hair loss as well as the female pattern hair loss, treatment of hair loss symptoms comes first, because of the amount of hair that can be transplanted. And since in many cases the hair has only gotten thinned out rather than lost, it can still be restored through treatment. It's also necessary to figure out how much change is the right or the wrong amount. However, if you tried hair loss treatments for a whole year and you haven't seen many results, it means that you have been through the maximum effect period you can get from a hair loss treatment. However, a hair transplant will be done if it becomes a cosmetic problem, even if the range is narrow. In the case of hair loss on the top of the head, hair loss may progress to some extent, so if the hair becomes thinner, it may look empty even if the number of hair is still sufficient. At this time, the density or the distance between the hair follicles is checked to see if a hair transplant is recommended. If the distance between hair follicles is too close for transplantation, hair loss treatment is recommended first, even if hair loss seems to be progressing. However, if the hairs are not too far but not too close to each other, we will proceed with a combination of hair loss treatment along with the transplantation from the very beginning. So, with that said, depending on the person's hair loss, when to go for a transplant and when to receive treatment first is decided upon treatment. Not all hair loss patients have to undergo hair transplantation surgery. Some patients can be helped with simple hair loss treatments. Or you can have surgery early and use hair loss treatment in combination to get a very good effect within a short period. We recommend to determine the treatment method after discussing your condition with a specialist.